Welcome back to the Brando and Joe podcast. Our guest today is Dr. Ronald Nicholson. He received his PsyD in clinical psychology and is currently a clinical psychologist at the Cognitive Behavioral Center for Cognitive Behavioral Psychotherapy. Welcome, Ronald.
Thank you so much, guys.
Thanks for joining us. So I know you got to talk to Brandon at the recent Metro event, but I wasn't able
Yeah.
to attend. How was it? What was the topic? What did I miss?
The topic, now, Brandon, you can correct me if I'm wrong. It was a lot like speed dating. They broke us into groups, and you go into either a small group or a couple of people, and you get a interesting question to start off, and you all get to know each other. So it was a lot of introducing yourself over and over again, really quickly, and you feel ridiculous talking about yourself with the same kind of sound bites that you use, but then you get to meet all these really interesting people with a lot of really interesting backgrounds and goals for what they want to do, and a lot of people who are early career, which is what you guys go for with this podcast. And it's always really great to talk to people who are really motivated and really driven, and they're just getting started. So they really want to cut their teeth. They want to prove what they're capable of. And often they want to make things better for the people that they're working with. And that's really energizing for anybody. And I'm always really happy to see people who are really excited about what they do.
Yeah, I mean, Metro is so great because you can tell that the people who care are there. And
Mhm.
the cool thing that was about that event, Lily set that up, and it was a newer thing for Metro where they provided people with the opportunity to meet before the year started. And it was in a little bit different of a format from the social that, Joe, I've been responsible for planning in the past. So it was really cool to kind of see that play out and get to meet some new faces at Metro and see what the year is going to look like. And I know you and I both are volunteering for them. So anytime we get to see things like that, Joe, it's cool. But Ron and I got to meet there, and it was kind of cool to get to speak with him because he has a different background than some of the people we've had on this podcast, specifically in clinical psychology. And we've kind of talked about that a lot on here, just with the idea of the overlap between people who start in clinical and then go into IO. And so now we wanted to get a specialist on here to talk about that with Ron. So Ron, we're going to just kind of start off and kind of hit some IO topics and talk about the
Yeah.
differences between, or like where you can see that overlap of IO and clinical. So
Mhm.
specifically in the work that you're doing, like how often are you seeing burnout, and like how does it affect employee effectiveness from your perspective?
Now, I work as a clinician, so I'm really new to the world of IO. And I kind of came at IO from the people that I'm seeing in my clinical practice. I'm seeing a lot of people who are high achievers, a lot of people who are high end in what they do, and they're dealing with the anxiety of the workplace and what they do. They want to perform better, they want to do better. And so that's how I kind of got the idea of IO. I started off by learning a little bit of performance psychology, picking up some textbooks and adding that to my clinical arsenal. And eventually I was like, what else can I do here? How often do I see burnout? Fairly constantly, especially now because people are experiencing anxiety and the fatigue from the election cycle. Hopefully that can play itself out and everyone can feel a little bit better in about a week. Uh, but whenever I mention that I'm a psychologist, it's one of the first things that I always hear is people saying, oh my God, I'm so burned out. What do I do? Across the board, anyone that I talk to. And then in my patients, across the board, just about everybody's feeling wildly burned out. And we're used to seeing this and thinking about this as being something that happens to professionals, the higher ended people in any organization. So the people who are higher up in an organization or people who have white collar jobs, but it's happening in every industry that I see. People who are doing the hustle culture of doing gig based economy, people who are the admins, the back office, everyone is feeling it right now whenever I talk to them. The research out there is saying that it's something like 90+%. But the problem is the research is often looking at specific jobs. So it'll be like amongst medical students or amongst the 1,000 professionals that we interviewed. And if you look at that research, especially if you look into people who are clinically disadvantaged by their symptoms, their clinically significant symptoms, 90+%. So somewhere between 91, 92% of people are reporting clinically significant burnout. Now, the problem with that research is that it's always in these very niche professions. If you want to try to generalize that out, it's probably going to be that across the board with a lot of different people. So people are feeling it one way or the other.
Ron, you said you picked up a couple IO psychology materials to kind of add to your arsenal. When you are using or when you're talking to a patient, and they are describing burnout.
So yeah, I
Are
picked
you
up some
using?
performance psychology stuff, to be clear. So IO is what I'm kind of
Okay.
learning to get a sense of. Performance psychology is what I tend to use in clinical work. So there's a lot of overlap with performance psychology and sports psychology, but it's a lot of things to help people perform better in the moment.
Oh, okay. So when you are talking to your clients, are you using what you learned in your clinic? Are you mixing the two almost? Or like when you add it to your arsenal, or are you kind of like picking a discipline and figuring out like which one works better for your patient?
It's always based on what the patient needs. Coincidentally, I've had a lot of patients for whom they have a real need to make sure that they're performing well. So that's why I started learning a little bit of performance psychology stuff. So that can be a lot of things like sports psychologist. One of the biggest quotes you see in that space is be where your feet are. And that gets into one of those things that can help anybody, which is when you're starting to feel that heightened anxiety, almost verging on the point of panic, because that may be a part of your job. It may be that some of your personal life is bleeding into your job, and it's starting to feel like more than you can handle. Be where your feet are. And that's something that people will say to themselves as they're like taking the field in a major sporting event. It's something that they tell, I think, NASA astronauts as well. Just be in this moment, because your brain's going to want to take you away to everything else that could happen or everything else that did happen in the past. It's usually when you're feeling a whole lot of anxiety, it's rarely about the moment where you are in this moment. And if you want to perform in this moment with what you got to do, you take it one step at a time and do exactly what's in front of you in that moment. You don't think about the consequences. You don't think about the next 5 steps, just this moment. In this moment, I just got to kick this ball. Or in this moment, I just have to suture this one vein. And then I can move on to the 40,000 others that need to be taken care of before the surgery is over. And people can benefit a lot from that, more than just in these kind of cliche high stress professions. People tend to need that in times of acute distress, wherever it comes from. And that can include difficult conversations with a boss, difficult conversations with an employee, just getting your task done under a tight deadline, or even just getting back home and making sure that you want to get things taken care of without letting your work life bleed into your home life.
Yeah, that's all awesome. I feel like it's a unique perspective because I think that when you tell people you do IO psychology, I think
Mhm.
the clinical side of what you're explaining is what people think we do. And like it's a little bit different for us. It's a little more nuanced and a little focused more on the performance side, like you were saying.
Mhm.
I love the idea of pulling in like those types of grounding techniques that you were speaking to there. Those are helpful. I know I used to coach tennis, and that was something we would do with
Mhm.
the people that we coach, my clients there. So that's really cool to hear that that's something you work with your clients on. And I think that you did a really cool job explaining the idea of burnout. It's definitely something that Joe and I have talked about a lot. Maybe not on this podcast, but I remember our first day of graduate school. We showed up for orientation,
Mhm.
and they did like an interview of like why everyone was in the why everyone joined the program. And I want to say, Joe, you can correct me if I'm wrong. It's like 75% of people mentioned they were burnt out and they
Mhm.
wanted to fix it. So
Right.
like the fact is like it's so true that that's something we're seeing, and having somebody with your expertise to work with your clients, I think is great to have for people in the workplace. I want to transition us to kind of dive a little deeper into some of the content you were mentioning there, Ron.
Mhm.
So you were talking about maybe some grounding techniques or focusing on
Mhm.
performance psychology. What are some like clinical interventions that you used or seen for like teams or in like leadership? Like, what does that even look like?
Well, something that I would say is use okay for teams and leadership. I'm sorry. The real truth of the matter is for teams or leadership, where I come from in the clinical world, the real intervention is individual therapy. And that's just my level of expertise, and it's what I do. But it's also something you can't overlook how effective that's going to be because you're dealing with the individuals. And that kind of gets into what is the overlap between clinical work and IO work. And that overlap is improving the individual's performance. And that's what my clinical work has kind of led me towards and what I like doing and why I started looking at IO because I can do this. And not only that, there's this whole field of IO that's all about, well, how do we get all these different people to all perform better? And I'm sort of looking at that like, oh, making individuals, helping them do their life better is what I do. And with my clients, with my patients, When we work on one thing, it helps to improve everything else. When I help one of my clients, we're working with like family and home life stuff. Family and home life stuff, we work on that. And then he reports in later, like 6 months later, it's like, oh, I got the best job review I've ever gotten. Oh, because less of his home life was bleeding into his work life. The thing is, the person's a whole person, no matter which way you cut it. And those two things are always going to affect each other. Stress at home is going to affect your decision making at work. Stress at work is going to affect your decision making and who you are when you come home. If you can treat the whole person, you're going to do better in all of these facets. And inevitably, with my clients, once we hit some of the major things that they say bring them into therapy, eventually they end up getting to, yeah, but I want to make sure I can do better and achieve my goals and be my best self. And we end up getting into all these things that would help improve employee effectiveness. And they want to work better, whatever those specific goals are. So that can mean people, college student getting into an Ivy League school, had someone getting into medical school, doing well at their jobs, things like that. Like these kinds of goals come up, which brings me to another point. Psychology is often thought of as treating illnesses. And the thing is, that's only half the battle. It's also about helping people do better. If it was only treating illnesses, then as soon as we treated all the things that went wrong, okay, that's good, you're out the door. But inevitably people say, yeah, but I want to be able to achieve my goals better. I want to be able to do these things that are important to me. Okay, so we work on that. And you can get into, if you're only treating the illness, that's only half the story of what psychology can do and what clinical intervention can do. There are hedge funds that require their employees to be in individual therapy. They bring in an IO psychologist, but then they require everyone to be in individual treatment. And they help set that up because the stakes are so high. There's so much money on the line. And on a bad day, you're going to lose a couple $100 million. Well, to make sure that that person doesn't take it home or spiral, let that one day of work stress make them, they have one bad day at home that causes some kind of argument, bad decision that then spirals. To make sure that person can come in the next day with a fresh mind, even though they lost $100 million the day before, they make sure everyone's in individual therapy. And that therapy, we're talking about people who were very smart. They had a lot of banking experience. This is not about treating people who have something necessarily wrong with them. It's about making sure that they can do well. And so they did. And that was helpful for those people. And I know that a few different funds do that. And the metaphor that I often use is like, if you have a car that you rely on to get your work done, you are going to make sure that that vehicle is working. You're going to get it checked in regularly. You're not going to wait until the check engine light comes on to get something checked out. Because a lot of people who are listening to this podcast, a lot of professionals, they're very smart about that kind of stuff. They know to take care of it. And they know that, small, regular investments in maintenance is a lot easier and a lot cheaper than waiting until a problem occurs. The same is true for your mental health. Regular investments in maintenance can help you avoid bigger problems down the line. And just regular stress and anxiety could be seen as the check engine light. Burnout is when the engine stops working, which might be when you turn the car on in the morning. It might be when you're driving down the highway. Happened to me one time. That's not fun. But that can lead to other problems that come up if that burnout hits at an inopportune moment. It's a lot cheaper and easier to avoid that altogether. You can get the better performance out of your employees by making that kind of treatment available and encouraged.
Ron, you brought up the cool point about the hedge funds and how like some funds have like a mandated individualized therapy. From your knowledge, do you know if other, not just funds, other organizations like have actual clinical psychologists come in and work with employees rather than maybe just like a talent management section of the company?
Professional sports teams, they have sports psychologists that they will bring on. And that's a lot of the how to perform on the field. But realistically, there's also going to be a lot of work about what are you bringing onto the field for the sake of this common goal of making sure people can perform their best in that moment. It's going to be about what are you inclined to bring with you that you got to keep off of the field. And that applies to all of us. Like we're all people. None of us are this platonic ideal of a worker that exists only as a worker when we're in the office and completely takes that home hat off we all have stuff that we can bring to the table, baggage that might come in. And having someone to help make sure that we can keep that at the door when we need to, it's not a bad thing. So I know that professional sports teams regularly hire psychologists to make sure people can perform at their best. And intermittently, other major groups that may require top level performance may also do that, but I'm less familiar with that. I know that sports teams in particular regularly do so.
I don't know if you guys have seen the show Severance, but it's a really awesome show on Apple TV, and the whole premise of it is taking someone's mind and quote unquote severing it for when they work versus when they go home. So they like
Oh
don't take
yeah.
home anything with them that they did at work, and then they don't take anything from home with them to work. But then it creates this crazy relationship in the show of like you're now two personalities, and it's a
Mm-hmm.
really awesome show. I highly recommend it from like a psychology perspective. It is really interesting to watch, but also
Mm-hmm.
like IO clinical. I think it makes it really fun to look into that. You know, actually have a question for you, Joe, because like we're hearing a lot about
Uh-oh.
we're hearing a lot about like this idea of clinical psychology, and I'm not nearly as well versed in that as you are. Like, are you hearing kind of where the bridge is between IO and clinical from your perspective? Like, what are you hearing from what we've been going over with Ron that's kind of built your knowledge into the IO space from what you had?
So, Ron, I'll give you a 2-second background. I was maybe 3 seconds away from applying to school psychology programs,
Mm-hmm.
um, and had a last minute change and ended up doing IO and wanted to go more the business route. Um, so that's why I was also excited for you to come on. And Brandon told me you guys got to chat at Metro.
All
Uh,
right.
for your question, Brandon, there's a similarity and a difference. Maybe Ron, maybe you'll describe them better, from the school psychology route to the clinical route. Um, I don't know if I could speak from exactly from a clinical route, but
Mm-hmm.
from a school psychology route, uh, I worked a lot with people with disabilities. Um, I don't know if I necessarily ran into like burnout and things surrounding that nature. The one thing that I learned that I was able to kind of bring into IO that I've found a connection with is the idea of patience, and how patience in the workplace is very valuable, because I
Mm-hmm.
can see when people start getting uh, overwhelmed with other employees or coworkers, uh, which can lead to stress and can lead to arguments. When if you just take a couple seconds and does it really matter that much? Might not be the best way to say it. For like, can we boil this down to like an idea of, uh, can we simplify the argument? That was kind of like one of the connections I saw when having to have patience when working in school psychology for this year. But from an actual clinical route, I don't know if I know enough about that topic.
No, it's totally fair. I was just wondering because, like, with my background in business, like, this is stuff that we really don't touch too much. And then, like, kind of diving into IO, it's kind of more on the outside when we go into stressors and think of OHP, which is like org health psychology. Like, that's a different side of IO that I'm not necessarily as familiar with. So back to you, Ron. Can I ask you
Mm-hmm.
another question here? Like with all of this and kind of going to Metro and kind of looking into all of your resources and what you've been doing, what has been maybe, and this is also something that we haven't prepped you for, by the way, so I'm just asking you this off the cuff, but like, what has been your favorite IO psychology terminology or perspective that you brought into your clinical practice?
Mm. So the favorite thing that I've taken from my meetings at Metro and applied to my clinical work with patients.
Yeah, Metro or IO Psych or just anything in general.
Metro or IO Psych in general. Okay, the world of IO. The thing that comes up in my clinical practice the most that I'm surprised by, because my background was heavily, there's two main branches in clinical psychology: CBT oriented stuff, cognitive behavioral therapy, or psychodynamic. CBT is very like, what is your specific thought? What are these specific behaviors? How can we very specifically handle this? How can I give you something specific to do? And then we go. And dynamic is very loosey goosey. It's very slow. It's very unstructured. And the thing that kind of gets me that I'm reminded of with all this is how much we can all benefit from, as though you were saying, patience. Looking into all this. And if you look at IO, it's a lot about taking a big step back and looking at things from a more bird's eye view perspective. How do all the different cogs work together? And if you want to make each individual cog work better, one thing that can help is if each individual cog, i.e., the person, can exhibit a lot of patience. And it's something that like therapy is very good about is getting you to kind of one, not care what other people think, getting you to get a better sense of what do I care about, what don't I care about, and then having patience for other people when they aren't doing things in the way that you would prefer, patience for yourself when you don't do things the way you want to go, would want things to go. And it's a lot of, you develop that patience by deciding what matters and what doesn't. And sometimes when you can take that bigger bird's eye view, like IO kind of requires you to do, it helps you decide this is the thing that I care about. And the rest, maybe I don't care about so much. Other people can look at things and do things very, very differently. And that's okay.
So, Ron, we wanted to end off with one of our last questions that we ask all of our guests, that you briefly touched upon in the beginning of the episode. In your career so far and going through school, what's one bit or piece of advice that you think you could pull that would be useful for incoming students or early career professionals that would you think really benefit their journey?
I will say this would be good for people who are early career in IO, and hopefully it can be good for them as they move along and they are both instructing and then becoming leadership, which is work on yourself. Get into that therapy room. You will never know how much you don't know until you go outside of your comfort zone. You can't teach someone something that they don't see they don't know. If they think they know it all, they're never going to learn. You get outside of your comfort zone, you start to realize how much you don't know. And there is nothing more uncomfortable than being vulnerable in front of a mirror. That's kind of what therapy can be. Look under those rocks. See what's in there. Put a mirror up to yourself and your habits. It is uncomfortable. It is not fun. But that's how you figure out who you are. That's how you work on the growth edges that you took for granted. But then you're able to do stuff that you never would have thought you could do before. Get rid of the social anxiety. Stop blowing up at people. Be more patient with yourself. Handle more stress than you thought you could, because at the end of the day, you realize that all those things that can be very, very stressful when you care aren't the things that you care about. So you're able to handle that. And it's a level of growth that takes a lot of practice, but it's possible. And the more influence you have with other people within your organization, the more potent that becomes, because you're going to influence all these other people. They're going to count on you. And the more you work on yourself, the better you are able to be there for them. You're going to leave your own baggage at the door so you can be there with that person, not dealing with your own stuff when you talk to them. You're going to have practice looking at things from someone else's shoes, so you be more patient with them. Have a better idea of understanding what they're talking about and how to help them get from where they are to where they want to be. You want to be good at your job. Doesn't matter what your job is. Work on yourself.
Yeah, that's a great soundbite for us. And you know, I kind of think about that in terms of when you go to therapy or when you have to work on yourself. Like it's a lot easier when you're constantly doing it. And sometimes people will go to therapy and they will go and do that when things get bad, and
Right.
then and then things get better and then they stop. But
Mm-hmm.
honestly, like the whole point of doing something like that consistently is to build that muscle. And I think of it just like training for a sport. Like if you want to get good at something, you do it all the time. And like it's the
Mm-hmm.
same thing about working on yourself and going to therapy. And Ron, I think that's a great point to add, because I think it can have a huge impact in your career. And the tools that you work on in therapy are something that can work across the board in your life. hence why we have you on here to talk about like applying your psychology principles to individuals who are in the workforce and things of that
Hmm.
nature. So I think it's a really great point, and I love that you were able to drive that home. And before we let you go, Joe and I wanted to give you the chance to open up about anything you're doing, anything you're working on, and where we can maybe direct people to getting more information from you after this episode if they're interested.
Absolutely. You can always find me at drronaldnicholson.com. And there you got the running blog and links to all my socials to figure out everything that's on my mind and everything I've been up to recently. We got videos on there for helping people calm down and stay grounded that I've gotten from the performance psychology world, and hopefully I can get more of those out there. I'm way behind on that. But yeah, you can always find me at that website, drronaldnicholson.com.
Yeah, no, thank you again for coming on here. It was such a pleasure getting to meet you at Metro, and hopefully we'll see you more.
Happily, anytime.
Yeah, hopefully I get to actually meet you in person, just like Brandon. One day
See
down
you
the
at the
line.
next Metro thing.
Thanks, Ron.
Excellent. Thank you guys so much. You take care.
Take care. That was a fun episode, Joe. I feel like you know, I love when we get in these episodes, and I feel like I learned something, and I definitely felt like I learned a lot there. It was cool to hear Ron speak about everything.
Yeah, we may have talked about the clinical world like a couple of times, but not into like this depth. Uh, so it would be cool to like have other psychology disciplines on the show and like talk about their overlap with IO because it was really great with Ross.
Yeah, you're giving me some ideas of people we can maybe reach out to. I think that'd be pretty cool. So definitely love that. And I know that a lot of us here from like just from doing this podcast, I feel like we hear so many people in our field that started off in this clinical route. So I think having Ron on here was kind of grounding for the IOs out there. Hopefully they listen to this episode and think about like kind of what started them down this journey and what they're doing in their work and how they can help the individuals in their workplace for sure.
Yeah, no, absolutely. Thank you everybody for listening, and we will catch you next episode.
See you guys in 2 weeks.